share my screen. Okay. Can you see my screen? Yeah. Okay, so let me introduce myself. So my name is Jyotika Goel. Rajpal is my husband's family name, but officially it's Jyotika Goel. I'm a healthcare quality and compliance professional with over 15 years of experience. And so I'm very happy to introduce myself, a little bit about myself, my family, my education and work experience. So I've just put together a little agenda. So we'll get started with the introduction and then education, work experience, and a little bit about my other activities, and then a summary, and we'll have some time for questions. So I grew up in Chandigarh, Tri-City, India. A little bit about my family. My father, he was an engineer. He's retired now. My mother, she's a housewife, and I have one brother. He's a biotech scientist, and he lives in Boston. So here is a picture of my parents, with my parents. And I'm currently married. So this year in November, it'll going to be my 10th marriage anniversary. And my husband, he has his own business. He's always been in business, and right now he's in restaurant industry. I have a 7-year-old son, and I have very lovely parents-in-laws. And here there's a picture of me, my husband, my son with my in-laws. And here's a picture of me, my husband, and my son. And a little bit more about myself. So since childhood, I've always been inclined towards like painting and art. I also love to design. So whether it be fashion designing, jewelry designing, interiors, and I and my husband, we love to travel and explore, and we really love food. So my husband is in food industry, so and we both love to eat. Okay, so let's get started with my education. So my high school was from St. Stephen's School in Chandigarh. So this is a picture of my school. And Chandigarh, I do not know if some of you know, but it's called the City Beautiful of India. And then I did my bachelor's in dental surgery from Shri Guru Ram Das Institute of Dental Sciences and Research in Amritsar. So yes, I did start off as a dentist. So here's a picture of my college. And Amritsar, if you know, it's a city of the Golden Temple, which is a World Heritage Site. And then after completing my dentistry, I did work as a dentist for a couple of years before moving to United States. So then I came to US to do my Master of Public Health, and my major was health management policy, and I did it from San Diego State University. And this is what brought me to San Diego. And then after graduating, I also did some certifications in healthcare quality. So I'm a certified professional in healthcare quality. It's called CPHQ from the National Association of Healthcare Quality, which is very well acknowledged certification in healthcare quality. I also did a master's certificate in Six Sigma, which includes the Green Belt, Black Belt, and Lean Six Sigma from Villanova University. And then also I was a scholar for Geriatric Workforce Enhancement Program with UCSD School of Medicine. And then let's move on to my work experience. So some of my early work experience, as I said, like, after I graduated, with my dental degree, I worked as a dental surgeon in India for a couple of years. And when I was doing my Master of Public Health in San Diego State University, I also completed a short internship at Fortis Healthcare in India in the departments of quality and patient experience. And my official internship was at Kaiser Foundation Hospital in San Diego. That was in 2009. And I interned with the regulatory affairs, kind of like, they oversaw compliance and the audits, as well as quality. And then after I graduated with my Master of Public Health degree, that was the time when, we had, the economy was going through a recession. So it's not that I found a job right away. There was a gap. I was looking for a job. But then, after some tries, I got a job as a program coordinator for Hospital Association of San Diego and Imperial Counties. That was in 2010. But yes, as I said, the economy was going through a recession. I had a layoff from that job, pretty like in 3 to 4 months. And then I went on to complete my certification, the CPHQ, to just make my profile a little bit stronger. And then I got selected as a performance improvement coordinator with Prime Healthcare. It's a large healthcare organization with over 35 hospitals in the United States. So I was working with them in the central office, and then I was working for about over a year at the Alvarado Hospital in San Diego. And then when I was working at Alvarado Hospital, my parents wanted me to get married. They were like, hey, when are you getting married, right? So then, I moved back to India. I took a little break. I moved back to India to get married, but then I came back again, and I then I applied for jobs. And I started working with San Diego PACE. It's a San Isidro Health branch in 2015. So I started off as a quality specialist, and then gradually rose up the ladder. And then I moved on to the quality manager and the director of quality and compliance. So PACE, so just want to talk a little bit about PACE. So PACE is the program of all-inclusive care for the elderly. It is funded by both Medicare and Medicaid. And so the criteria to enroll in PACE is that, a participant, so we don't call them patients, we call them participants. They have to be 55 years and older. They have to have chronic conditions to meet the nursing level of criteria. Like they have to have some serious chronic conditions that makes them dependent on others to carry out their activities of daily life. And they have to live in the zip code. There is a service area for a particular PACE program. So there are over 100 or 150 PACE programs in the whole United States. And so this one was for San Isidro Health, and they just started their program. So when I joined as quality specialist, so I started with the very beginning when they just started their operations. So they grew from 4 participants to over 2,000 participants. And I was the one who started the quality program, and I hired the whole team, and I built their quality and compliance program from scratch. So from just me as a single being in the quality department, we grew to 25 employees that were reporting to me. And also want to let you know that PACE is an all-inclusive care, which means that we provide primary care. We are like a health insurance plan. So PACE is like a managed care plan. They get capitated, like a fixed amount from Medicare and Medicaid, but then they're responsible for the whole care. Whole care means like primary care if they have to go to the hospital or to a skilled nursing facility. So PACE program will pay for it. If they need help in the home, so they also receive home caregivers. They also receive transportation services. There's like an adult day center, like how you have for child care. So it is for adults, it's for elderly. So it's an elderly daycare center, and where they come, they socialize, they get meals there. They also participate in activities like they play bingo, and then they also have therapy, they also get the physical occupational therapy there. They get nursing care, right? Like they get their vitals checked. If they need any medications administered, they get it get that done there. There's a clinic, right? There's a clinic in the center, so they also can see their doctor if they need to. There's also an observation room in the center, and if they have to go to the hospital, like, you know, yes, like the PACE program will pay for it. So it's like it's just not medical care, but also like social, you know, wellness, and the overall the whole spectrum of care, and for 365 days a year. It's not like PACE center get closed in the evenings, but PACE program is responsible for all their care 24/7, 365 days a year. And that is why it's called all inclusive. So currently, I still work for a PACE program, but for another company now. So this company is called Wellbe Health. It's a fairly new company. Right now they have 4 programs in California. 2 are in Northern California, Stockton and Fresno, and 2 are in Southern California, so Long Beach and Pasadena. So I joined Wellbe Health in 2021 as a central quality improvement director. Like, I was responsible for all those 4 programs, and then I had my teams at the respective programs. But then as we were growing, you know, in participants, so Wellbe Health hired a quality improvement director for each program separate. So now I'm responsible for the LA Coast PACE program, which is in Long Beach. So as the quality improvement director, I have a team where I have like quality improvement coordinators, quality improvement specialists, data integrity coordinators, and I'm responsible for all their quality data submission to the state and federal agencies, data analysis, ensuring patient safety, also responsible for the state and federal audits. So that was like my professional you know, work experience. I have some other interests, as I said, like painting and, you know, art. So I also do jewelry designing. As I said, like I have interest in like designing, right? So because as I said, my husband is in business, so I having interest in designing, and he has having experience and passion for business. So we started this company, Mystic Planet Jewels. It's still in kind of progress. I still have to work on the website, Instagram, Facebook, kind of a thing. But I have been designing jewelry for his company. And right now I'm also learning metal smithing. So I'm taking some classes, and I also have interest for interior designing. So these are just some of my latest designs. And on the right side, where you see like a bride, so the bridal jewelry, so the red ones is like rubies necklace, and the rubies. So actually, she's my friend. She's my best friend from the dental college. She's a dentist in Canada. So she was getting married, and she knew about my interest, and she said, "Hey, Jyotika, you know, you do jewelry designing, so I want you to design my wedding jewelry." And so this is what I designed for her. And also, like, you know, I have a wish list. I do want to be a GI, a gemologist. I have a lot of interest like in gemstones and, you know, and the designing part of it. Also, I do want to start my interior designing business at some point, and I want to write a book. So yes, there's a lot, right? Like for women, I would say the struggle to juggle is real. Like, you know, we have to manage the home, we have to manage the work, we have to do the dishes and do the laundry, but at the same time, we are professionals, right? So so yes, we have to juggle, and time is challenge you to manage between work and home. So that is why I did put that picture that yes, like I have to juggle. I have to juggle between a lot of things. So I'm a mom, I'm a wife, I'm a daughter-in-law. So yeah, and a professional. And just some quotes. A successful woman is one who can build a firm foundation with the bricks others have thrown at her. And behind every successful woman is herself. I know we say before, behind every successful man is a woman, but behind every successful woman is herself. And yes, with the support of family, definitely. And just a quote like here, I didn't get there by wishing for it or hoping for it, but by working for it. Yes, you have to do a lot of hard work, and you have to be determined and passionate for what you do, but you'll get there. Okay, I'm open for questions.
Thank you for your amazing presentation. I can start with the question that I had actually. So you mentioned wanting to write a book. What genre would you want to write your book in?
Sorry, what was the question?
What genre, or like what would you want to write your book about?
Well, I just wanted to write a book about my life experiences, how, like, not just professional side, but also something personal side.
I think we have another question from the chat on what is your favorite part of everything that you do?
What is the
What is your favorite part of everything that you do from the
I
chat?
think my favorite, yeah, my favorite part is, caring for these elderly people. Yes, like when I was a dentist, right? I was providing direct care to these patients. Like that was very satisfying for me because I was doing everything. I was doing root canals, I was doing extractions, fillings, everything. But then when a patient would come to me and they would in pain, and then I was able to treat it, that was the most satisfying part. But as a dentist, yes, I was doing that to, like, patient by patient, right? Like, so here in public health, right, like in the healthcare management field, I'm not a direct care professional, right? I'm not providing direct care, but I'm on kind of like the back end. But still, what I do impacts these patients, so these participants, right? We call them participants. So it impacts them. But for example, any quality improvement that we do, like we also do handle the grievances, like if they have a complaint about something. And then if we see a trend, let's say they are complaining about the transportation, like the transportation is always late, they have to wait, right? So my role is to look at those trends, look at, hey, why the transportation is always late, and what can we do, what processes can we improve to improve the satisfaction. So when that change happens, when that improvement happens, to see that, and to get that feedback back from these participants, I think that is the greatest part, right? Like to making those process changes and improvements.
What do you think is the most difficult part of your job?
The most difficult part is change. So with every improvement comes change, right? Like you have to change the process. Sometimes you have to say, hey, okay, we are doing this in a certain way, so let's change it because this is not working. So change, I am an agent of change, right, as a quality professional, but making that change and having others accept that change is difficult. It's challenging because they don't want to change. They have been doing this for many years, and they do not want to change that, right? So always with change does come others not wanting to accept it. There's always obstacles. There are always going to be people who would not like it, and they would oppose it. And yes, there would be people who are going to leave their job, who are going to resign. But yes, we have to make the change because eventually we have to improve. So I think change is the most difficult part.
What advice would you give to young women who are looking to pursue a similar profession?
Well, I would say that be be determined and be like whatever you're following, like even if they're going to be ups and downs, like I had in my career, right? Like when the economy wasn't good, I had a layoff, and I there was a time when I was looking for a job and I couldn't find one. So there was that gap. So I would say that do not let yourself feel low. Just keep trying. There's going to be an opportunity that will work for you. Also, I know, like, I was a dentist, right? Like a lot of people would ask me, why didn't you pursue dentistry in United States? Like dentistry is a very well-paying job. So why didn't you pursue it? All my friends, they came to US, they went for their dental exams, and they went to the dental school. And they're dentists now. And why are not you doing it? Well, I would say, like, everyone has their own preference, whether it could be like be due to family or due to some other circumstances. But every profession is good, right? Like, if you keep working hard and you keep moving towards your goal, you can be successful in a career. So I feel like right now, like, even if I'm not a dentist, but I'm still in healthcare, and I'm impacting, and I'm impacting people's lives in a different way. Maybe not in direct care, but in other way in healthcare quality. Also, like, even if someone doesn't want to be like, or they do not get selected in a dental or medical school. So there is this another profession like healthcare quality and compliance, where you can also advance your career to be the CEOs of the hospitals. So those who run the hospitals. So there is this another profession in healthcare which are also very rewarding.
All right, thank you.
Does anyone else have any questions that you want to share in the chat or say out loud? If not, I'll just ask one final question. This one's more about your interest in jewelry designing and some of your other interests, but how did you really develop your interest in jewelry designing, or how long have you been interested in it? And in the future, do you hope to make that your main career, or?
So I have been inclined towards art and painting since I was a child. My mom tells me that when I would, like, even as a kindergartner, when I would come from school, even before eating lunch, I would open my drawing book and I would start to draw. So it is something that's, that just been, inborn in me. And so even when I was in dental school, I was telling my parents, can you please send me to Jaipur? I want to learn jewelry designing. And they were thinking like, hey, am I like, I'm like just taking a full, U-turn from my career and just going a different direction. But so I have been doing it, like, even for my own wedding jewelry, like I would, just tell the jeweler, just make this and that, like, just in some kind of informal way. But formally, I have been doing this for 5 years now. And I know I do not want to make it my main profession. My main profession is going to be healthcare quality and compliance. But yes, I do want to run this as a side business. And since it's my passion, like designing and even interior designing, I just want to, just take out some time, on the side, like on the weekends and the evenings, and keep doing it.
Thank you so much for your presentation and your amazing responses. We are so glad to have had you today.
Thank you. It was really nice presenting to this group.
Yes, thank you so much, Jyotika. You gave some really insightful advice, and
yeah, thank you. And if anyone has any further questions, you can reach directly to my email address. I put it there.
Sounds great. Thank you everyone for joining. Thank you, Jyotika, for presenting. And if anyone has any questions, you can contact me, or you can contact Jyotika or Nivi. I think that's going to be about it for today.
Okay. Thank you. Bye, everyone.
Thank you.
Thank you.
Thanks.
Goodbye.